The broadcast is now starting. All attendees are in listen-only mode.
Welcome, everyone. Thank you for attending our webinar this morning on HR Trends for 2013. I'm Bill Horst, the Chief Revenue Officer with SharedHR, and I'll be moderating our discussion today. We're on a tight schedule, and we want to be respectful of your time. Because of this, all attendees have been muted. If at any point during the webinar you'd like to ask a question, please type it in the questions box in the GoToWebinar control panel. We'll answer questions at the end of the presentation, and if for any reason we're not able to get to your question during the webinar, we will get back to you privately after the webinar has concluded. When you exit the webinar, you will see a survey. We would really appreciate your candid feedback on that survey. Now I'd like to introduce our speakers for this morning. Paul Finkle is CEO and founder of SharedHR. Paul has more than 30 years in HR and management consulting, has lectured at Stanford's Graduate School of Business, is a consummate entrepreneur, and is often called on as an expert witness in complex employment litigation. Jeff Close is the CEO of BenU. Prior to running BenU, Jeff was the president of Fox Hollow Technologies. Jeff has also been an adjunct associate at the Stanford University Center for Health Policy, and he's also testified on healthcare reform before the U.S. Congress. With that, I'm going to turn it over to Paul and Jeff to start our webinar.
Good morning. This is Paul Finkle. Again, thank you all for attending. The history of this webinar really comes from our annual strategy meeting with our clients over the years. During these kinds of meetings, we review data, information from their HRIS, and try and help them make evidence-based decisions and suggestions about staffing adjustments and plans for the future. Clients are always asking about what trends do we see, since we go to different seminars and read different books and articles than they do, and what are the best practices out there. So as a result of these questions, about 3 years ago, we started these annual Future Trends seminars in HR. And this is our third annual seminar, or webinar. This year, since healthcare is on everyone's front burner, I asked my colleague and partner, Jeff Close, who's an expert in healthcare exchanges, to join us and share his perspective. The idea of what we're going to present today is really an overview, so you all can get a taste of what we see as the future and that no one is surprised. Also, we're going to try something new in that after each section, we're going to let you participate a bit, and we're going to present a poll where you get to vote on a question that relates to the topic we just discussed. So with that, let me go over the agenda that we're going to talk about this morning. First, we're going to talk a little bit about unlimited time off. Is that a crazy idea, or is it a future trend? Next, we'll talk a bit about the growing attack on independent contractors. Next, Jeff will take over and tell us about healthcare exchanges, which is going to be a front burner topic for all of us in the coming months. I'll return with a discussion on the war for talent, which appears to be heating up in our world. And then lastly, we'll close the future of HR. We will provide a little time at the end for questions. Since we have the largest attendance in the history of doing these, pardon me, almost 800 registrants, we will not be able to take everyone's question. But if you do have a question and you submit it, we will get back to you, pardon me, as quickly as possible. So let's talk about unlimited time off. What does this really mean? It means doing away really with traditional vacation, sick leave, or PTO. And it is a trend we are seeing more and more. In fact, 3 clients have us working on policies for this right now, and it was such an interesting phenomenon, we decided to make it a trend for this year's presentation. Many of you may remember that during the .com days, there were many creative benefits that were presented out there. Everything from pet insurance to ping pong tables to beer breaks every afternoon. And unlimited time off is actually a little different than that. What unlimited time off really does is address some of the changing values that we see out there in the workplace. many workers, particularly younger workers, will actually trade time off for money. And this addresses that kind of trend. And as we're going to talk about later, it also is one of those competitive advantages that employers can use in the war for talent. This is not restricted just to startups. Companies as large as Netflix, HubSpot, the Motley Fool, and even IBM all have some form of unlimited time off policy. So what does it really mean? Well, it works very well in our client examples for those organizations that are virtual because it's hard to police everyone's time anyway, and by having no structure like this, or no formal structure, it gives a lot more flexibility. We found that it works best, certainly in white-collar scenarios. I do not think this would work in a manufacturing setting at all. It can turn out to be an outstanding recruiting tool because if you're trying to get that highly sought-after engineer, this is the sort of policy that might make him select you as the employer of choice. What it does require is an excellent commitment on the part of workers and a certain strong level of trust on the part of management that people are actually going to get their work done. So it's really strangely akin to a contractor type relationship where you're really looking for the results and you're not so concerned about face time at the office. So there are some pros and there are some cons that one ought to consider before thinking about such a policy. The pros are that there's no accruals, so you have less administrative headaches to consider. As we mentioned earlier, it can be a positive recruitment tool. Also, it can be a major morale builder. In the United States, we have far less vacation than is found in many European countries. And as I mentioned earlier, the workforce now, particularly the younger workforce, is often seeking greater time off. And as work life and personal life distinctions blur and meld, this can be something that is a very advantageous morale builder. It can also improve performance because lots of times performance can happen outside of the workplace. It also can be a substitute. If you're a thinly funded startup, it can substitute or perhaps count for what otherwise might be sought as cash compensation. And lastly, there is no PTO cash out. This, frankly, is what caught the eye of two of the clients we're working on, namely that they didn't want to have to cash out large amounts of vacation. Now let's step back for a moment and note that in states like California and in many other states, you're not required to provide vacation, sick leave, or even holiday pay. But if you provide it, let me make a quick adjustment or qualification to that. If you happen to work in the city and county of San Francisco, you have certain requirements. Same for Manhattan and downtown Boston. But in other places, you really don't have these requirements. So if you're going to offer them at all, then you can discuss, well, do I want to offer it in an unlimited fashion or do I want to offer it in a traditional fashion? The cons are that this requires a high level of trust because people are going to be basically treated as adults and given as much free time as they need. Next, it also provides scheduling challenges because people have to make sure that they know exactly who's going to be working and who isn't. You need to have excellent productivity measures. You've got to figure out how to reliably cover the work, so you've got to be good at your game. This also can be abused, and you've got to figure out what you're going to do in the event that it is abused. And then the policy's got to address things like extended leaves. If someone's out on extended medical leave, are you going to have limits at some point in terms of maintaining their pay? So it's really not for everyone, but it is something that we think is interesting. You might want to consider. It's best, we've found, in startups. When you have a small group and people are back-to-back against the world, then you can pretty much trust your cohort to do the right thing and take time off. Many times in these policies, they're recommending 4 to 6 weeks a year off. So it really is something that people encourage, or the employers are encouraging them to take the time off. The one caveat I will also remember, or would like to remind you of, is, let's say you currently have a vacation sick policy in California. You cannot simply erase vacation balances in California. This is true in many other states. You can't have use or lose it vacation policies, which means that if you transition from a traditional policy to this unlimited time off policy, you're going to have to figure out how you're going to transition those existing balances. You also should consider this in context with your flexible work schedule and your remote schedule, and make sure that all these policies mesh. So now we're going to try our first poll and see what you think about whether or not you would ever implement something like an unlimited time policy. And what we're going to do is we're going to feed the results of these polls back to you following the webinar in a blog. So I believe
the poll
you can
is up
see,
now.
Yes, I believe you can see on your screen the question that's out there to you, and you can vote in the box which is displayed. And the question is, would you consider implementing an unlimited time off policy in your workplace? Yes or no? Do you already have one and this does not apply? So those are your choices. And we'll give you just a few seconds to vote. You're not required to vote, but we thought it would be interesting to get your feedback on each one of these trends and whether you think it's real in your workplace.
Okay, Paul.
Okay.
Back to you.
Great. Thanks, Bill. So now we're going to talk about the growing attack on independent contractors. Some of you may recall at the beginning of 2010, Obama specifically instructed the IRS to target misclassified workers. That's the government's euphemism for independent contractors. Essentially, it is the view of virtually every government agency I've dealt with in this area that if it's an independent contractor relationship, it's sort of guilty by association, and it is a misclassified worker, and it is up to the engaging entity, the company, to prove that it is in fact a legitimate contractor relationship as opposed to an employment relationship. So we've handled multiple cases of independent contractor audits in the last 12 months, and they seem to be growing in our experience. So I would be remiss in this trend seminar not to highlight this. Now, for those of you who are fans of our webinars, we are going to have a very in-depth contractor webinar next month that we'll mention at the end of the presentation. But for now, I want to give you kind of the highlights of what the trend is and what the implications are to you. For technology companies in Silicon Valley, for example, it's common to find interns and new hires brought on as contractors first as sort of a test. This happens in startups a lot as well. Bringing people on as contractors who are not set up as businesses is extremely risky and, in fact, almost impossible to defend. So if independent contractors are a big part of your workforce, or even a small part, this may be time to review it. So I thought one interesting way to do it would be to ask you a series of questions and then answer them for you and tell you why I picked this question. So the first one is, to qualify as an independent contractor, the contractor must have other clients or streams of revenue. Is that true or false? Well, the answer is that's true. If it's a standalone business that is arm's length from the engaging entity, the investigating agencies all want to see, well, do they have other clients? Can they work for others? Do they have other streams of revenue? Can they show themselves as a stand-up arm's length business? And that is a key factor. Now, all the factors that I'm going to be talking about here which are really only some of them, these factors are not absolutely determinative, each and every one of them. They take kind of the preponderance of evidence, or the scales of justice, if you will. But I'm going to give you 10 little questions to think about related to your contractors. An independent contractor must show significant investment in his or her business. True or false? This is also true in California. So if your contractor total investment in his or her business is the person's laptop, that's probably not going to cut it. In one audit I had a couple of years ago, even a pickup truck dedicated to business was not considered to be a significant enough investment. So you've got to show, and they're looking for things like employees, office space, equipment, desks, chairs, that sort of thing. So the next question. An independent contractor should not perform work that is part of the regular business. Now, this particular question came right off of a question from the California EDD to one of our clients that's in the middle of an audit right now. The view of these investigating agencies is that it's a clear contractor relationship if you own a technology company and you hire a painting contractor to paint the outside of your building. No question about that. It is not part of the regular business. It's an outside entity, no question. But if you have a senior programmer working next to a junior programmer, that is a much more complex shade of gray. And you need to be able to show why that person couldn't be an employee. So if the person has super high skills and sells those skills to others, you may have a good argument there. Also, and let me just give another caveat, there is risk if these relationships get disrupted for both the contractor and the engaging entity. Because if the contractor has a lot of business deductions and takes their brother-in-law to dinner and writes off the home office and files a Schedule C, all that's going to get disrupted if the contractor relationship gets disrupted and it's ruled that the person's misclassified and should have been an employee. And they're going to have to file amended returns, and there's going to be more tax involved for them. So there's an incentive for them to work with you. Next, unskilled laborers cannot be classified as independent contractors. True or false? Basically true. If it's an unskilled laborer, how are you going to show that that person's got a standalone business? So what most organizations do now, after the lead cases in this area, is they hire third-party contractors to be the employer of laborers and then contract with that entity. And if you've got people in this classification or category, I would suggest you consider doing that. Independent contractors can be paid hourly so long as they're not on payroll. Well, that's true. You can do that, but it's a very dangerous practice. It's much better if you can pay them by the week, by the month, or by the project, because you want to show every distinction you can between an employment relationship and a business relationship. I might also add that there's another threshold point in California, which is there must be a written agreement that spells all this out. If you don't have written agreement with your contractors, it's virtually indefensible. Next, when a worker converts to employment status, he or she should not perform the same or similar services as an employee as he did as a contractor. True or false? That's true, but that's a hard one, because what happens lots of times is people might start out as a contractor and then convert. So if you're going to convert a worker, it should not be a scenario where you play King Arthur and today the person's a soldier and tomorrow you pull out your sword and knight the person and they become an employee. That's not going to fly. There needs to be a change in the work. And if you do it, it's a smart time to do it at 12/31 of each year. Because when you get audited, they look at your tax year and they compare your general ledger against your payroll. And if somebody was receiving a check to Joe Jones as a contractor and now suddenly Joe Jones is an employee and they're on both ledgers in the same tax year, that's going to raise a question. So if you're going to do a transition, it should be a business reorganization that requires somebody to come inside as an employee. And that should happen at the end of the year if you can possibly orchestrate it. Next, once a startup raises a round of funding, it's an appropriate time to convert contractors to employees. False. Just because you get funding and startup doesn't really mean anything. It's about the work they're performing and whether or not they could really stand up as an arm's-length business. Next, when confronted with an audit request by the state or the IRS, do you have to immediately comply? The answer to this is false. What you immediately ought to do is get some professional help, because the way you characterize the facts and circumstances that they're going to be asking about is absolutely critical. And I might add, in all the audits I've been involved in the last few years, they always interview the contractors. And if those contractors are, shall we say, unsophisticated about these indicia of contracting, it can be a very uncomfortable situation. Next, you can pay a worker up to $600 cash without reporting requirements. Under the IRS, yes, you can. Under the state of California, no, you can't. So if you have casuals that you're paying cash to, that's a very risky practice. Next, if you engage an incorporated contractor, you are not required to file a 1099 with the IRS. Is that true or false? That is true. So this is a very important tactic if you want to maintain a contractor relationship or have to maintain one for whatever reason. And you want a very clear level of insulation. In all the audits I've been involved in, if you can show that the entity is an LLC or a corporation, then typically they're off the table right away, because these reviewing agencies view those as very clear indicia of standalone business, because they're paying the minimum $800 corporate tax and they look like a standalone business. Next, if you are audited, the way most audits start, in my experience, is from a disgruntled contractor. Either someone who is unsophisticated and applies for unemployment insurance after the end of the contract period, or somebody intentionally gets upset and runs to the IRS. And then, if you think about it, you've got your former contractor who signed a contractor agreement now sitting on the same side as the table as the auditor, identifying where they believe every bone is buried. And so that's a very uncomfortable situation. And the only way really to deal with that is to make sure that you've got your act together in advance. So first, I'm going to give you the indicia that they ask for right off the bat. They look for business cards, websites. They look for some kind of business investment, and they want to see invoices. This is the most common thing I see. You know, you wouldn't just pay your outside painting contractor without an invoice. So if you've got internal contractors, they need to be invoicing you so that you can show you're paying invoices. And you should be paying business entities. You know, my example earlier, if you're paying Joe Jones as a contractor and then now it's Joe Jones employee, it could at least be Jones Consulting or something. And these are the sorts of things you have to do if you hope to show any kind of arm's length relationship. Now, lastly, if anyone's interested in this a little bit more in the interim, and you indicate in an email, we'll send you what ought to be in a contractor's file, just as a checklist, so you can do your own little audit. But what we'd like to do next is to kind of gauge your level of risk by asking you to take another little poll. And in this next poll, we're going to ask you about your contractor relationships. So, Bill, if you could present the poll.
You got it, Paul. It's up.
So what we're asking you here is what % of your workers or your workforce are independent contractors? And we have several categories: 0 to 25%, 25 to 50%, 50 to 75%, 75 to 100%. So please indicate what level of contractors you have. And I'll leave you as you're voting with this last little vignette. We have one client now who has a $2.2 million judgment against them from the California EDD regarding their contractors. And let's just say that they're at the bottom of the hill trying to climb up to get this negotiated. And it's probably headed towards litigation, which is not going to be a satisfactory resolution. But I raise this only to say that this is a real issue out there, and these audits are increasing in our experience.
Okay, Paul, I closed the...
Okay. So now let me turn it over to my colleague Jeff. And Jeff, if you would be kind enough to enlighten us a bit on healthcare exchanges, we'd appreciate it.
Great. Thanks very much, Paul. Well, it's a pretty complicated and varied topic, and certainly fraught with a lot of uncertainty these days. But for us, it's a pretty exciting time because we've actually been building and operating multi-carrier exchanges for over 10 years. And as Paul said in the introduction, back in 2004, I actually had a chance to present to the Joint Economic Committee on healthcare exchanges, and Paul Ryan was in fact on the committee. So it's kind of interesting to see that come full circle now, as we're talking about healthcare exchanges. We're going to talk a little bit about public and a little bit about private, but first I think it's important to talk about the current trends. And one of the most interesting ones, obviously, is the election. And with Romney and Obama, excuse me, with President Obama, I think everything will continue pretty much as is. With Romney, I think it's going to be a very interesting situation because he most likely will defund a lot of the exchange activities that are going on. And as a result, I think you're going to find states sorry about that. You're going to find states without funding to actually continue some of the exchange activities. So the uncertainty around this, I think, is pretty interesting, and you're going to see a lot of different states kind of wait and see. And in fact, a lot of the activities in healthcare reform has already begun. But around the rules, there's still many, many rules that have to be defined. And I think that's what you're going to see as we go forward is, with the lack of understanding, the lack of rules, it's going to be a pretty disruptive period. And the one thing I think, though, that is true is that healthcare reform is here to stay in one way or another, regardless of President Obama winning or Governor Romney winning. So they're going to be here and stay. In the public exchanges, actually, Paul, if you want to flip over to that, I think that's interesting there is on the public exchanges we have only 16 states out of the 50 that actually have some level of activity. And, if you can look at the blue and the red maps, you'll probably be able to figure out that a lot of the states that are not doing any activities are Republican-based. And of the 16, 10 have some legislative authority in place. 4 have done more of a governor executive order type thing. And then 2 of them actually have existing exchanges up and running, and one certainly is in Massachusetts that Governor Romney put into place, and one is in Utah. But that means that a lot of states aren't doing anything related to exchange development. And in fact, the exchanges have to be up and running by 10/1/13, which is only a year from now. I mean, it's not very far away. And if these states don't actually get things up and running, the feds could have the opportunity to come in and take care of that. And I think that's also going to create some pretty interesting dynamics on the political side when most of the states that haven't done anything yet are trying to keep the feds out and don't want to do anything related to exchanges. So that's going to play out a lot depending on the election of how the feds and the states interact between, who's going to run the exchanges or not. The other interesting point is that there's a very different type of exchange that's being developed, and the example would be in Utah. There's what we call more of an open market exchange, and in that it's kind of all carriers, anybody can participate, they want everybody to play. The state's really just acting as kind of a market maker for the various carriers to sell their products. What's different in California in particular is they're taking a very active purchasing role, and it's a complete contrast to the situation in Utah. And what they're doing is they're saying in the 16 different regions within California, they're going to bid out and take different carrier options in each of those. So rather than saying any carrier that's allowed to sell insurance in the state of California can sell it, they're going to, on behalf of the employees, make the decision for them about what carriers are going to be available. And I think that's pretty interesting in that the complexity of what they're trying to do is enormous because they're going to do it by region. And if you think about how much or how little time they have left between now and next year to actually implement this, it's an incredibly complicated process. And they've spent to date over $400 million trying to get these up and running. So I think that is going to be a really interesting test of a state's ability to actually pull this off. And clearly, if Governor Romney were to win, I think the first thing he would do is defund this. And if that happens, California's made it pretty clear that they just don't have the capacity and the available money to continue it. So I think that the elections will definitely have an impact on kind of how the public exchanges play out. The other thing that's interesting about public is that will be the only place that employees can get subsidies. And any other employer-sponsored health care or private exchanges that we'll talk about in a little bit, the subsidies are unavailable through those. So you'll have to go to the state to get those subsidies. And that's going to be one particular advantage of going to a state exchange is the access for lower income workers. And it'll all be based on a combination of percent of poverty level. And one of the other really interesting and complex measurements is that it's based on family income. So if you think about that, how do people track family income? And we can track individual employees, but if the spouse works, somehow they're going to have to figure out a way to track all of that to determine the subsidies that are available. So there's still a lot of complexity associated with these public exchanges and how they're going to play out. What's different in the private exchanges is there is no subsidy. That's kind of one of the key elements in that is that they truly are private exchanges. And they could be sponsored from an employer, a carrier, a vendor. Like in our case, we sponsor a private exchange. So it's a completely different way to organize, in essence, consumer choice, which is really an important part of an exchange setup, is you're trying to provide choice at the employee level. And the other trend that we're seeing now that's kind of deja vu all over again is we're seeing defined contribution. And it's interesting that for a long time that fell out of favor, but now I think, it's the same transition from the retirement benefits going into from a defined benefit to a defined contribution. We're going to start to see that same trend, I think, in the healthcare space. What allows you to actually implement that is you have to have a choice of products and services to buy with that defined contribution. So that's really where I think the intersection of the private exchanges may come in, of the choice, a defined contribution approach to give employees more choice in the matter. But the one thing that's still, there's a couple of big ones that have come out recently. Sears and Darden have announced their decision to kind of exit the space and go into an exchange-like setting. But in general, I think the challenge carriers have is that they're so focused on the healthcare reform, and not just the healthcare exchange, but all of the elements related to reform. It's a daunting effort for them to figure out the compliance. So I think we're seeing an emerging interest in private exchanges, but I think there's also so much work going on around the space in general that it's going to take a little time to kind of flush that out. So we'll have to kind of wait and see how the public exchanges play out through the elections, how that then impacts the private exchange market. And it's interesting because we've had conversations with a lot of employers, and you get incredibly varied responses about what they'd like to do. And in fact, Paul's going to put up a question to kind of get at that and see where we are. If you want to throw the first poll question up there, Paul.
Sure. So we wanted to get your take as participants on what you consider to be or what you might do in the future. So would you consider offering a private exchange to your employees prior to public exchanges being offered? And by private exchange, we mean sort of your own mix of choice in an exchange. And there's a place to answer yes, no, or you're not sure and you need more information. as I mentioned earlier, we're going to feed back this information to you via our blogs so you can see what people were thinking.
Also, we will be posting the recorded webinar and all of the supporting material either later today or first thing tomorrow as well. Paul, with that, I'm going to close down this poll.
Okay.
Send it back to you.
Well, don't forget the second question.
Yeah, we've got one more coming up about, the interest is if in fact public exchanges get off the ground and become available, the question would be is you, as an employer, would you consider terminating health coverage at that point in time? And in essence, send your employees to the exchange and no longer be involved in the procurement and delivery of employee benefits.
And so we give you a choice of yes or no. And for those of you that are not familiar and haven't read that much about this, an employer would, under the current version of healthcare reform, an employer would have an option of saying, I'm getting out of the business of insurance and I'm not going to provide insurance for my employees. And then that employer would be essentially fined or taxed per employee per year, and that money would then go to the state-run exchanges. So presumably the employees would be eligible for the state-run exchange. So if that were viable in your state, would you consider it? Okay, Bill, thank you. In the interest of time, we'll keep our pace moving here so we can have a little bit of time for questions. The next trend we see is an incredibly heating war for talent. We've talked about this in some of our past trends, but it's getting more and more intense in our world. And it seems sort of contradictory because you read about some of the highest unemployment and that's all you hear about in the political speeches. But the reality is there is a mismatch between talent needed by employers and the talent being offered by candidates out there. Throughout this recession, and I was watching a CNN little program on this in the airport the other day, that this trend is now being identified even by the news services as a mismatch of talent. And we think this is going to get worse. And it's a result of a confluence of factors that we're not investing in our education, that younger workers don't have some of the basic skills we need as employers to put them to work. If you think about the numbers of software programs you have in your organization, and the ability that someone must exhibit in terms of learning, you can begin to see the problem. We even had a case earlier this year where a client company acquired another company for its talent primarily. And I think we're going to see more and more of that happening in the future. We also had a case recently where a senior person had been a candidate, we'd found that person through LinkedIn, had multiple interviews, and at the last moment there was a retention bonus provided by the current employer, and this candidate wouldn't leave. That's another example of what's going to happen in the future. So even if you think you've identified somebody that could add to your organization, you can't always get them. And then when you do, you sometimes have to stretch the salary cap. We've had more and more cases of where Craigslist and LinkedIn are just not yielding the results sought by our clients. And yet you can't turn, for financial reasons, to the search firms because they just can't afford these higher search fees. And moreover, these job postings sometimes are getting stale. So what can you do? Well, first of all, you should always be looking for talent, in my opinion. And that means if you have key, hard-to-find positions, they should always be posted on your website. You should always have some sort of trickle recruiting going on. And if you get a talented person, even if you're not really looking for them, you ought to take a hard look at them sometimes. That creates a problem when finding talent really is that many employers really aren't as clear as they need to be on what position, what are the qualifications you really need out there. And sometimes they change over time in the organization, and those job descriptions that are being posted are no longer reflective of what the skill sets are really needed. That is very critical to the retention, which of course is the other side of the war for talent. And if you know for sure that you're not going to be able to find those talented individuals to continue to build your company, the last thing you want to do is lose the good talented ones you got already. So you've got to be looking at the back door of your employment relationship as well. Also, you need to constantly think about creating an environment where employees can succeed. That's why this trend we talked about earlier of unlimited time off is not as crazy as it first sounds, because you want to create an environment where people want to be there and that they have the tools for success. There's all sorts of surveys out there showing that probably the #1 factor these days as to why people leave is a poor relationship with their supervisor. So creating this environment where supervisors are part of the team and everyone's working together is critical. If you do have to find a position, one of the best ways we've found is really going back inside and leveraging internal resources and saying, all right, guys, we got to find somebody else for the night shift. Who knows somebody? We're going to give some kind of a new hire bonus if you can help us find someone. And that seems to be a very useful technique these days. And then finally, particularly with senior people, my philosophy has developed over the years that your final interview really ought to be a negotiation. And by that I mean you need to be bone honest with what the job really is, and if there's extra hours or there's travel or you allow remote working or there's a flex schedule, make sure you talk about all that so that the person really understands what they're getting into. That seems to make for the best longer-term employment match. So in the interest of time, we've got a bit of a poll again, and we want to find out how much each of you in the audience is getting pinched by this war for talent out there. So Bill has posted another poll, and what we decided to do was ask you, the classic measure in acquiring talent typically is the amount of time it takes you to fill a position. So we're asking, how long does it typically take you to fill a position? And we just want a rough sense. Is it 0 to 30 days, 30 to 60 days, 60 to 90, 90 plus, or you don't know? But we just want to get some idea of our audience as to how much this war for talent is really squeezing everyone in terms of ability to fill positions.
So it's interesting, Paul. Predominantly, the respondents are in the 30 to 60 day range.
That's good. I would submit to you that you'll move into the next bracket between now and next year, based on what we're seeing in our practice.
Again, all of the poll results will be posted on our blog later today. And with that, Paul, I'll give it back to you.
Thanks, Bill. So our last trend that we want to talk about is the future of HR. And there's some very important changes happening in the HR world that many of you in the audience probably are more than a little bit aware of. The old HR model, where you had one HR person that was sort of the bottleneck of paperwork, is quickly being dispersed and replaced with technology. Most organizations are looking at an HRIS or already have such a thing right now. Many small employers don't yet, but an HRIS, an integrated platform of payroll, HR, and benefits, such as the relationship we have with BenU with our platform, is really going to be the way of the future. And you'll start hearing about this more beginning this week, because I believe this Friday, Workday is going public. And that IPO is going to bring a huge spotlight to the area of payroll, HR, and benefits. Now, they work mostly in enterprise, larger organizations, but the ability to have a database and pass data without having to touch it all the time, is going to be really critical in the future, becoming more efficient. It's also the key to being able to provide information to managers and employees. So the role of HR, being a paper administrator, is converting to a business partner, in our opinion. In fact, McDonald's actually calls its employee relations HR folks HR business partners. And that's a trend we see is continuing. We continue to believe that people are the essence of competitive advantage. So if you think about, well, what's the most important job of HR? Well, it's not pushing paper, and it's not figuring out how to fire employees that don't work. It's in my view, it's attracting talent and retaining and developing that talent. So that's really the most important role. So HR's got to now start focusing on, well, wait a minute, if we got the quality of the caliber of candidates is going south, right at the time when things are getting more complex and employer needs are going north, how are we going to handle all this? And with increased levels of software complexity, it's becoming more and more of a challenge. And I would submit that the HR world is becoming much more technical, and I mean technology technical, not just compliance. And senior management is wanting data-driven decisions. They want reports. They want facts on which to base the future. And that's really where we see HR going. It's good HR, we think, is becoming decentralized. And through the use of technology, it's being pushed down to managers. That means that the HR team really has to become more of a change leader and not simply an administrator or the person that tells a manager what they can't do. In fact, the HR has got to be someone who empowers managers to work more closely with their employees because the employees expect more online services and support, and so do the managers. So there is some sort of right mix, some optimal mix of technology and staff in all the areas of the business. And this is one of the jobs of HR, to look at that for the business, we believe, and to figure out what that mix ought to be today and what it's headed towards for tomorrow. As you go through this, and you're starting to do this in your own organizations, I can't emphasize enough to have clear, efficient processes. Many of the processes in HR haven't been looked at in most organizations for many years. And if you just take those old processes and automate them, you're going to get more efficient broken processes. So you really need to look at those. You need to get software and tools in the right hands. And there's a lot of software out there now. Putting all that together isn't as easy as one might hope, but the tools are there. Next, you need to tie the use of these tools to performance management. That's going to pull everybody together. And then you need to find out for your organization what really is that right level of human support to make it all work. And that's a moving target as well. But the characteristics of HR software that you should look at, in our opinion, are that it needs to be flexible to your needs. It needs to have some form or moving towards step-by-step screens so that someone isn't presented with a huge learning curve of a new piece of software. Next, it's got to have compliance built in to all the documents into these step-by-step screens. It's got to be logical and intuitive in its design, and then you got to integrate the systems. And so the way we look at the HR landscape looks something like this. That you have an HRIS kind of in the middle, and that pulls in everything from learning and background checks to tracking your independent contractors. It connects with a system like BenU has, where you have online open enrollment and built-in workflows and rules for your employee benefits, so that it automates the entire decision process about who's eligible and at what time. It also connects to 401k, COBRA, FSA, and all these things talk to payroll and accounting as well. So we put this out there as one way of looking at and organizing the HR function to get it more technology-driven so that you can get the kind of information out of the system to really make those good future decisions with. So with that, we have one more poll we'd like to talk to you about, and that is we're curious about where you are in terms of looking at an HRIS. Do you have an HRIS now? Are you thinking about one in the future? Because we believe this is a trend that's moving forward, and we want to get your feedback on that. And then as you're answering that question, I want to sort of lay the groundwork for the corollary question, which relates specifically to BenU and your benefits system. And Bill, if you could post that one, if you wouldn't mind.
You got it.
And this question really is, do you currently use an online open enrollment system with these rules-based built in? Because as Jeff described, none of us see anything that's going to make the whole benefits landscape any less complicated or less costly, for that matter, as time goes on. So using technology to make it as efficient as you can inside is something we see as an important trend, and we wonder if you agree.
Okay, Paul.
So great. With that, we're now going to move to the question phase of our presentation. Obviously, we recognize that we've covered a broad set of topics, only a couple of inches deep, but we wanted to give you some taste of what we view as the trends. And Jeff and I thought that we would answer a few questions. We have many, many participants today, and folks have been submitting their questions throughout the presentation. And now, Bill, I'm going to ask you to take over, please, and ask whichever one of us you think is appropriate to answer these questions.
Absolutely, Paul. So the first question goes to you, Jeff. From a high level, the questions being posed is to what exactly is a healthcare exchange?
That's good questions.
Right.
Yeah, so it's the easiest way to describe it is it's a marketplace or a shopping center. In its simplest form is you'd be able to give employees, if you think about today, many employers offer one health plan and maybe one or two benefit options. The concept of a true exchange is a marketplace where you might have 2, 3, 4 carriers. You might have multiple product options to choose from that. In today's world, it's very difficult to kind of pull all that together and give that level of choice for an employee. And that's why, it's really going to vary from the state level, is some are going to have every carrier with any product that they want to sell, to the California model, which is much more limited, much more controlled about what's available. But nonetheless, the concept is that the employees would then be able to spend their money, kind of based on their own unique requirements and based on the cost. So it's just going to provide more of that, kind of shopping experience. And hopefully have additional benefits other than medical, life, disability. It would give them all the different benefit options within this kind of exchange setting.
And then if, Jeff, in those models, an employer could make a decision that we're going to fund X dollars per employee per month, or Y percent of some number. And so you could adjust, premium share and so on with employees. Would that not be correct?
Yeah, and I think what's interesting is more employers than not offer a contribution strategy that's a percent-based. So in other words, they would, kind of disproportionately subsidize a higher cost plan. Where I think you're seeing the market move now, though, is they're going to say, okay, we're going to give X dollars, and then the employee can make that decision if they want to pay the extra to buy up to a richer, more expensive plan. So it's kind of exposing the cost of the plan more directly to the employee than it's been done in the past. And really the only way you can do that is if you just give them a fixed dollar amount and let them make that purchasing decision of how much extra they may want to pay to buy the additional benefits.
And would it operate like some cafeteria plans operate now, Jeff, where, if an employee says, all right, look, I don't want disability, I'll go for the higher medical?
Yeah, it's a good question. I think it's unclear as to whether, you're going to be able to take a dollar amount and only use X dollars, and they kind of predefine this is available for medical, and then you can buy up to a more expensive plan. This is what's available for dental, and you can do the same thing. Or is it, here's a lump sum of money, I don't really care how you spend it. And I don't think we have clarity around how that's going to work, and in some cases the health plans will have a say in that, just because it can drive risk selection and some other dynamics. So it's a little unclear how that will play out, if you just get a lump sum to purchase anything and everything, or whether you'll get a defined contribution amount, kind of per product, and then you have to make a decision from that.
Great. Thank you, Jeff and Paul. I just wanted to also mention we are reading a slew of questions currently right now, and we will answer all of them and post them. We're not going to be able to get to all of them in the next couple of minutes. Paul, this one goes out to you. Question is, we're a small organization of roughly 35 employees. At what point do you find the investment in an HRIS worthwhile?
Well, that's a good question, and it varies from organization to organization. I would say if you're a fast-growing organization, it would probably be worthwhile near term, no doubt. In our experience, we sort of see a few key inflection points in an organization's growth. Usually it's around 25. Basically, it's when spreadsheets start getting unwieldy. That's first sort of tip-off that might be a problem. The other is it kind of depends on the level of HR transactions. So if you are a fast food restaurant, you may have only 30 employees, but you might have 150% turnover. You need a system at that point to be able to manage all that. Dollar-wise, I think it starts to really make sense at around that 25, 35 person level, especially when you look at combining payroll, HR, and benefits, because usually those activities are fragmented within an organization, or they're part of somebody's time. And we look at it as, well, what's the highest and best use of that person's time? And if it's spent maintaining a spreadsheet with all the opportunities for error or chasing papers around, in most cases you can make a very strong argument that a piece of technology can really save time and help leverage the organization.
Great. One last question. This one's for you, Jeff. Where is the best place to get more information on healthcare reform changes and implications?
Well, you certainly we'll provide contact information, and they're welcome to contact us, and we can give them a list of various links, whether it's at the state level or more the federal level. There are a number of different places that the government actually has information online, and there's a lot of also just private entities that provide additional information. So if they send that information over, we'll be happy to provide them with the links to various places.
Okay. Great.
That brings up one other point, though, that I might want to mention, which is that I know we have in the audience people from many different states, and maybe even some outside of the U.S. And these regulations, as Jeff was mentioning, and certainly on a lot of the HR and employment regulations, do vary rather significantly by state. So if you've got a question on a particular matter, please be sure to identify, what state you're operating in, so that we can give the most accurate answer. At SharedHR, we spend a lot of time and money doing multi-state compliance every year, and we're starting to get in the season of that right now. And I'm just mindful that there are major differences on some of these points by state.
Right. Okay. Well, we are at our limit time-wise. So
well, thank you all, everyone, for participating.
I did want to just clarify, too, again, we will be posting all of the poll results. We will also post the webinar, a recording of the webinar, supporting documents. Paul mentioned an independent contractor audit. And our next webinar, which we discussed briefly, is on independent contractors versus W-2. And that webinar will be Wednesday, November 14th from 10 to 11 a.m. as well. Anything else, gentlemen?
No, thanks very much.
Thanks very much, everybody. Appreciate it.
Thank you, everyone.